Hi, this is Jim Fiorentini. Thanks for listening. Between now and at least April, every week I'm going to report on the coronavirus situation and how we're doing with the vaccine. We're getting started with vaccine planning. There isn't all that much to tell you, but let me tell you what the goals are and what we're doing. Starting sometime in February, probably the second week in February, the vaccine will be available to phase 2 in the state's plan. Phase 2 is essential workers, people who work in the food industry, including grocery stores and food manufacturing, people with 2 or more comorbidities, things that make you susceptible to the injury, and people 75 years of age or older. So if you're in those categories, I know there's many people listening who are 75 and older. You'll be eligible to get the vaccine starting sometime in February, right now looking like the second week, but this changes on almost a daily basis. Our goal is to give you a number of options where you can be vaccinated. The first will be the state is setting up mass vaccination sites. The nearest ones to here will probably be the Topsfield Fairgrounds, you all know how to get there, and Lawrence General Hospital. There is no mass vaccination site scheduled for Haverhill. The idea is they're going to be within a 30-mile radius of each other. There are going to be many other options available. Most people are going to get vaccinated at their own PCP, their own personal care physician's office. I know the physicians are just starting to get planning on this. There is no way to sign up right now. I get a lot of calls every day, where do I sign up? That's not available yet, but it will be. Keep in touch with your physician's office about this. In addition to that, both CVS and Walgreens are going to be offering shots to the public. Again, they're just getting started in the planning. They don't have any immediate plans right now. You don't need to call them, but just keep aware of the newspaper and social media, and that will be announced. We are working on being able to set up some sites in Haverhill where people can be vaccinated. It's a massive undertaking. It's most of my time now is trying to set this up. We don't have a big public health department. Most communities don't. We have one nurse, that's what we have. So we're expanding that. We've got ads out for other nurses. We've asked for volunteers. 40 wonderful people in Haverhill, retired doctors and nurses, have volunteered to help administer the vaccine. We're going to be hiring a company to train them. Then we need locations. It's, again, a massive undertaking. But our goal is to be able to have 1 or 2 sites in Haverhill where you can get vaccinated if you can't get in right away to your doctors or to CVS or Walgreens. Now, again, all of this is starting in February for essential workers, people with 2 comorbidities or 75 and up. Towards the end of phase 2 is February through April, it goes down to people 65 and up. There's a lot of pressure on the state government to advance that. The Center for Disease Control has recommended that governors put people 65 and up higher on the list. And I believe Governor Baker will do so, but he indicates he's thinking about it. Starting in April, vaccinations are open to the general public. We look upon all of this as practice. Right now we're doing our essential workers, our frontline workers, and then starting in February we do 75 and up. And then starting in April, mass vaccinations to the public. Again, it's going to be the pharmacies, your general doctor, and vaccination sites will be setting up around the city. I'll report to you every week, and feel free to call me if you have any questions. Thanks for listening.